Hi, everyone. A little late this morning. It's okay. I'm Dr. Arafid, owner of Vet Triage. It is June 26, 9 a.m. Pacific time, and we're going to talk about arthritis. I do have a video that goes this in a bit more detail on the channel. Check that out. And I figured we would do two things with arthritis. We'll keep it brief. We'll just keep it very general because it is a complex topic. And also, we'll focus on degenerative osteoarthritis, idiopathic osteoarthritis, meaning the arthritis that we all think of when we get older and joints start to hurt. We're going to focus on that. We're not going to talk about infectious arthritis. We're not going to talk about immune-mediated arthritis. This is specifically just your run-of-the-mill idiopathic degenerative osteoarthritis that happens over time. So there are other forms of arthritis, those caused by infections, those caused by the immune system, but we're going to focus on the very common and what most people would want to be interested in, which is general arthritis. So we don't know what causes arthritis in dogs, and a lot of these principles are applicable to people as well. It's called idiopathic, which means of unknown medical reason. So arthritis in general is idiopathic. It forms for unknown reasons. Maybe it's genetic, maybe it's lifestyle, maybe it's trauma, but it forms over time. As you get older, you're more prone to it. And we all know that some individuals are way more prone to developing arthritis and show way more symptoms with arthritis than other individuals. You could have two 55-year-old people and one person is struggling with arthritis, one has no signs of it, right? And it's the same thing with dogs. And I don't necessarily think that I see arthritis more in one breed of dog than the other, although you could probably argue that larger dogs are more prone to arthritis than the smaller ones because they're carrying more weight, there's more micro trauma, and they also tend to grow really fast too as puppies compared to smaller dogs. But really, any dog can get arthritis, and it's not breed specific. But it does progress over time if we're talking about the run-of-the-mill general arthritis. So we don't know what causes it. What you end up happening with arthritis is many changes to the bone, the joints. So the bones that involve the joints, the joint capsule, the cartilage, the synovial fluid between the joints, the whole microenvironment and macroenvironment of a joint is and can be affected from degenerative changes. So you'll see things like bony growths will occur, which is the equivalent of like bone spurs, let's say, for people. You'll see cartilage erosions. You'll see a cyst formation in the cartilage itself. You'll see a closing of the joint. You'll see a joint capsule that's not as stretchy. It's much more scarred down, thickened, inflamed. The nutrition and the general circulation of the environment of the joint, which keeps the joint healthy, becomes altered. All of these factors and much more are what occurs in any given joint. And that's what you end up developing with arthritis. When you think about arthritis from a more like realistic or clinical perspective, it really manifests itself with the clinical signs. So what I'm describing with all those changes happens at a microscopic level and macroscopic level. So anatomically, histologically, you'll see all those changes. And oh, look, we have Sarah here. Sarah, can bone spurs be removed? So yes and no. For your run-of-the-mill arthritis, we have a second person here. Hi, second person. For run-of-the-mill arthritis, you can't remove the bony changes that occur. These changes are permanent, irreversible, progressive. However, there are sometimes conditions where you can clean up the joint, and removing bony formation like that can be one of those things. The problem with that is invariably it's going to come back. That's the thing. Now, sometimes one of these bone spurs, let's say, and again, we're kind of using the term inappropriately. It's really osteophytosis or enthesiophytes, depending on the location within the joint. But if one of those fragments, let's say, broke off of the bone and now is floating in the joint capsule, we call that joint mice, or joint mouse, then you can remove that. We're using arthroscopy, for example. And so that is technically speaking removing the bone spur. But there are other procedures that are analogous to what Sarah is asking, where doctors can also smooth the cartilage or even cause microabrasions in the cartilage to help with increased blood flow to that area to try and help healing, and also try and numb the nerve endings. Again, none of these options are great because arthritis is not a treatable, curable issue. But there are things you can do surgically, which I would consider probably more salvage procedures. Salvage procedures are those procedures that you're doing because it's like a Hail Mary. You're doing it because it can maybe help and maybe can make things worse, but the patient is in so much discomfort that you have to do something to help them out, and that's a salvage procedure. So yes, you can remove these things, but typically, by far, this disease is a non-surgical disease. It cannot be cured with surgery. In fact, if I had to pick one surgery, and this will go into our next topic, which is treatment options, arthrodesis, which is the permanent fusion of a joint, would be one surgical option to try and both salvage the joint, salvage the limb, or rather salvage the limb, but you're obliterating the joint by permanently fusing it. Obviously, that's a problem because now you can't move that joint, and joints are meant to move. But it'll hopefully, if it goes appropriately, if it goes correctly, hopefully the pain is gone. So again, when you replace a joint, you're replacing all that diseased tissue, the bone, the cartilage, and making the joint one segment, which again is both good and bad, right? So our joint arthrodesis is a potential surgical option as opposed to what Sarah's asking about, the bone spur removal. The other surgical option is amputation. If you have a dog or a cat, but this is mostly a dog issue as far as we can tell, although I think cats are grossly underdiagnosed. If you have a dog with really bad arthritis and like one limb is like really bad and the other three legs are not that bad, but one leg for some reason is just horrific, then amputation may be the way to go. But of course, again, the arthrodesis and amputation are two very extreme, I should say very extreme, but they're fairly extreme solutions for this problem. The vast majority of patients can either live with their arthritis with sufficient comfort to be functional and happy, and then a lot of them need medications and supplements and lifestyle changes. And so we can talk about that next. One more point real quick before going into treatment is diagnosis. So I was mentioning before that you have those microscopic and macroscopic changes. Those are things that we see on a cellular level, but you also can see grossly like in surgery. But also most people diagnose this stuff with radiographs, so x-rays. So your veterinarian will collect x-rays for your pet of the affected joints. Maybe they'll take radiographs of the opposite side for comparison to see what the symmetry is like or asymmetry is like, and then make a diagnosis from there. You can of course go fancier. You can go computed tomography, so CT. You can go magnetic resonance imaging or MRI. But by far the staple is going to be radiographs. They're convenient. They're easily accessible. They're way more affordable than CT or MRI. And sometimes no sedation or minimal sedation needed for your dog to collect those radiographs. And then that's how we diagnose it. Plus, you want an imaging modality that focuses on bone, which is great with radiographs and CT, less so with MRI. So anyway, so that's arthritis in a nutshell with regards to what causes it, general surgical treatment options, how to diagnose it, and then now let's talk about the most common treatment options, which are medications. So it's impossible pretty much to treat arthritis with one modality. Usually weight loss alone is not enough, or physical therapy alone is not enough. Supplements, pain meds, these things are all not enough usually in isolation, or at least as arthritis progresses, it's less likely that only one treatment will be sufficient. You usually have to provide what's called a multimodal approach. So multiple modalities of treatment are needed to treat a disease as complex as arthritis. So the video I have on my channel will go into more detail, but essentially your options are going to be weight loss, modified exercise regimen, physical therapy or physiotherapy, non-steroidal anti-inflammatories. So anti-inflammatories in general, but most of us are going to use non-steroidal as opposed to steroidal. Analgesics, so things like narcotics or opioids are going to help. And then supplements, most often something like chondroitin supplements or fish oil supplements or both. And that's those are. And then of course we talk about surgery, which is either arthrodesis and amputation or cleaning up the joint. And then in really bad scenarios where the person has tried everything for their pet and the quality of life is terrible, then euthanasia is also a viable option, let's say, for dealing with this. But those are the treatments that you have, and this is where medicine becomes less of a science and more like art, where it's going to be trial and error. Your goal as a pet owner of a dog that has arthritis is to use the minimal number of medication or medications or interventions or whatever that you need to get the optimal result, right? Nobody wants to overload their pet with drugs, of course. I know these crazy lifestyle changes. Everybody's busy and these things are expensive, and not every dog likes this stuff and whatever. So you need to think about arthritis as a continuum over time. You're going to be modifying the treatment plan depending on your pet's response to the treatments. And you want to use the minimal amount of drugs that you need or interventions that you need to keep your pet under control. And then over time, you realize that your pet is becoming resistant to some of the interventions. So you'll have to add things, take things away, change stuff, whatever, obviously done in conjunction with your veterinarian. This is actually a great way to use vet triage, because you can talk to a veterinarian on video about this, and a pet has already been diagnosed with arthritis. Maybe you're not happy with the progression, or you want other ideas or second opinion or whatever, and you can talk to our veterinarians to get more insight on your dog's condition. So that is those are your treatment options. With that, you need to be patient with it and realize it's only going to get worse over time, typically. And so these treatments are going to continue to evolve as the disease evolves in your pet. Yeah, and I think that's probably a good place to stop. It's a general overview of a very complex condition. Any questions, comments, let me know. Feel free to donate, subscribe, hit like, share, all that good stuff. Check out the other arthritis video on my channel, and we'll see you guys tomorrow, June 27th. We'll do another live stream and we'll figure it out. Thank you so much for Sarah for that amazing question, and for the two audience members. I think one might be Sarah. I can't tell. That's how live stream works, but there we go. See you guys in the next one. Bye.